This is the CDC's Emergency Operations Center. Think of it as the nerve center of its response to the Ebola outbreak. Just a few minutes after I walked in, phones and BlackBerry started buzzing everywhere.
While we were here, the activation level just went up to level 1, just in the last couple minutes. What does that mean?
What that means is just more people and more resources dedicated to the response.
In that room, you could feel a quiet determination and a sense of urgency.
What you're looking at is what the CDC looks at, a map of the world, trying to figure out what infectious diseases are happening and where they're happening. As you might imagine, a lot of focus on Ebola right now. They're tracking that as well, real time. They've been doing it since March. Take a look in here. This really jumped out at me. Mid-May, they thought things were basically under control. But then look what happens at the beginning of June. Everything takes off. This is on its way to becoming the worst Ebola outbreak in history.
Dr. Stephen Monroe is helping lead the CDC's Ebola response. Not an easy task at all.
Was there mistakes made? I mean, is there a reason why this outbreak is worse than any other outbreak in history?
The initial event, the lightning strike, if you will, was right in this corner between 3 countries in a very remote part of each of those countries. And so it quickly spread across the borders.
Here in the United States, different questions. For example, if Ebola is not airborne, then why were there such extraordinary precautions taken for Dr. Kent Brantley and Miss Whiteball? Turns out it was more an abundance of caution rather than a necessity.
We're pretty confident that any large hospital could handle an Ebola case if one were to show up at their doorstep, using traditional isolation rooms with a negative pressure room and with traditional droplet and respiratory precautions.
And while I suited up in multiple layers when I was in Guinea just earlier this year,
that can be worn by healthcare workers when they come into contact with patients.
The CDC says a mask, goggles, face shield, a protective gown, and gloves can provide all the protection you need for most situations.
The Ebola outbreak, the CDC is raising its alert to the highest level as it monitors the spreading virus, keeping a close watch for cases here in the U.S. ABC Steve Osunsami tracking it all from Atlanta, where the 2 infected American aid workers are being treated. Good morning, Steve.
Good morning, George. The family of those sick missionaries hospitalized just down the street here from the CDC are asking for prayers this morning.
This morning, disease trackers in the CDC's Emergency Operations Center are on their highest level of alert, monitoring the outbreak around the clock.
It's a sort of all hands on deck thing now so that we can draw on people who normally wouldn't be involved in this kind of infectious disease outbreak.
Fears over the disease causing panic in emergency rooms across the country. The CDC says 6 people in the United States have been tested for Ebola since the West African outbreak erupted in February. All results have been negative, including that New York patient who walked into this New York hospital with Ebola-like symptoms Monday. And the 2 Americans still in isolation wards at this Atlanta hospital now getting the kind of 24/7 Western medical care a specialist not treating them says just might save their lives.
The key here is excellent nursing, frequent vital signs, fixing problems. You have a dehydrated patient giving IV fluids. You have a patient who's anemic giving a blood transfusion.
Spain will now become the first country in Europe with an Ebola-infected patient. A 75-year-old Spanish priest working at a Liberian hospital is now back home at a hospital in Spain for treatment. He traveled inside this medically equipped military jet. In Liberia, this is what's passing for sanitation centers, buckets of water and hand sanitizer. This morning, we're learning more about 6 stranded Tuskegee University students who are studying abroad in Liberia. Their flights have been delayed for at least another 10 days because of travel restrictions in and out of the country. The university this morning saying that they are in a safe place and that they're all healthy.